Welcome to the deep dive. Today, we are taking a look at something really important, pregnancy blood tests. We're using a guide from Blood Test UK to help us sort of unpack the science and, more importantly, the speed of it all.
That's right. Our mission today is to get past the basics. We want to understand the biggest benefits and why local access, for people in Livingston and West Lothian, is such a game changer for making quick health decisions.
Okay, so let's break it down really, really simply. A pregnancy blood test is just when a doctor takes a tiny bit of your blood, and they're looking for a special signal, a hormone called HCG.
Human chorionic gonadotropin.
Right, and that's basically the little messenger that says, okay, a pregnancy has started.
Exactly. And this is where the precision really comes in. People ask, why go to a clinic when you have a home test?
Yeah, what's the difference?
Well, a home urine test is just qualitative. It's a simple yes or no. A blood test, though, is quantitative. It measures the exact amount of HCG.
Okay, so is that extra detail really worth the trip to a clinic?
Oh, absolutely, 100%. Because that accuracy leads directly to better health outcomes. The blood sample can find HCG much, much earlier. We're talking maybe just a week after a missed period.
That's early.
And knowing the exact amount helps doctors date the pregnancy accurately from day one, which is just essential for starting prenatal care on the right foot.
And this is where the localization piece you mentioned comes in, right? The guide from Blood Test UK talks about this. Being able to get this test quickly and locally, say in Livingston and West Lothian, it just removes a huge barrier.
It does. And beyond the clinical side, the process is quick, it's safe.
Yeah.
And getting those clear results back provides just immense emotional support. It cuts down on that anxious waiting time.
So if someone wants this early, reliable data, how do they get it?
It's actually pretty simple. You can arrange it through your GP, your General Practitioner, or you can go to a private facility. Just, a quick tip, always check with the provider first. Sometimes simple prep is needed, like fasting, just to make sure those measurements are as accurate as they can be.
And after the test, what happens next, according to Blood Test UK?
The results come back fast, usually within a couple of days.
And that's when the follow-up happens.
Yes, and that conversation with your healthcare provider is so important. That's when you go over the numbers and you plan the next steps.
Things like scheduling the first ultrasounds or setting up a monitoring schedule.
Exactly. Especially if the early results hint at a high-risk scenario. That early data gives you a huge head start. And really, the long-term value here is that continuity of care. It all starts with that first accurate number.
So if we boil it all down, getting that accurate early information from a blood test is, it's a critical shortcut to confident health management in a pregnancy.
It takes all the guesswork out of that very first, very critical stage.
A really powerful tool.
Yeah, and it raises a bigger question, I think. Something for you to consider. If a simple blood sample is so much better for detecting a hormone like HCG, what other common health checks might benefit from that same approach? Moving beyond simple yes-no tests and toward early quantitative screening instead of just waiting for symptoms to appear. Something to think about.